Hi everyone. We're still waiting for Dr. Jim to join us. I think he was on the Google Meet, um, but let's see if he's here now. Hi. Let me know where you are this morning or afternoon on Wednesday. Hi everyone, good to see you. So we're still waiting for Dr. Jim. No, I still not have any sign of him. Hi Dana. Yeah, so it's amazing. So definitely if you have any questions on weight resistance, weight loss resistance, or about lifestyle, any different diets you've tried, just type it in the comments. So if we had a chance, we can go through those. Okay.
I made it.
Hi. It's always like this. Always. The first few minutes. So how are you?
That's good practice for you.
How are you, Dr. Jim?
I'm doing good. How are you doing?
Great.
Looks
Very
like
good.
I'm a little rough here. I don't know. It's like the wind got wind blown. Got the wind blown look right now.
So, yes, Dr. Jim, amazing pharmacist, clinical nutritionist, my educator at A4M. Yes, and
Excited to
author.
be here.
Lovely. So, yes, we're talking today about metabolic syndrome or dysfunction, which 20-30% at least of North American people struggling with it, weight problems, obesity, diabetes, insulin resistance, the whole spectrum, fatty liver disease. So the main question is, how did we get here with that? Is the $1 million question. Is it genetics? Is it our
Oh,
environment? Is it hormonal disruptor, heavy metals, air, water pollution? Why suddenly, all of a sudden, this horrible big storm of people, visceral fat, and so many complications following? Any?
yeah, it's all of it and more, right? I mean, the first thing you have to think about is food quality. And in general, people eat too much, they eat too often, they eat too late, they pick the wrong foods, they don't get enough sleep, and they're under a lot of stress. So
Mhm.
before we even get to hormone disruptors like pesticides or toxic metals or mold exposure, there's just some baseline issues that are really disturbing people's glucose regulations. And people don't move. I mean, think about it. If you live in Sardinia and you're an 80-year-old, you're still walking up 400 flights of steps at an 18-degree incline every day, carrying your groceries. And, we have people that'll, get in their car to go to the end of the driveway to get their mail out of their mailbox, right? I mean, movement is a problem.
Mhm.
So I think, what's underappreciated is that weight loss and managing your metabolism is more than just how many calories you're eating and how much you exercise. It really is more driven around the concept of metabolic inflammation or metaflammation.
Mhm.
So metaflammation leads to inflammation, and at the center of metabolic inflammation is insulin resistance, meaning that you've seen this, right?
Yeah.
Um, People, they try to diet, they try to exercise, they don't lose a pound,
Mhm.
and they get frustrated. And what I've seen, and now as the chief science officer at Lifetime, where we have 2.5 million members, there's a lot of people that are in that situation. And the reality is, you got to wake their metabolism back up. And
Mm-hmm.
there's different aspects to that, right? It's exactly what you said. They may have a hormonal imbalance. Certainly, the way people have rushed to the GLP-1s, the Ozempics and the Manjaros and now the Ritutrides of the world, they're desperate.
Mm-hmm.
And and just using that is like putting a Band-Aid on a bullet hole, right? It's not all of the solution, but it's part of the solution.
Mm-hmm. Yeah, it's not all of it though.
Yeah, not at all. In general, when you see the complaints, right? There's these complaints of, I did Ozempic, I lost weight. As soon as I got off of it, I gained weight. Well, first of all, did you do anything to preserve lean mass? Did you change your diet and lifestyle habits? Did you eat healthier foods? Did you try to do some kind of form of exercise? Did you get better sleep? Did you
Mm-hmm.
change what got you there in the first place? So I think we're in this goofy kind of black and white war of people saying, GLP-1s are bad. No, GLP-1s are good. And no matter what, on either side. And the reality is that the truth is somewhere in between.
Yeah.
The truth is the fact that these new categories of drug are incredibly helpful to reestablish how glucose and insulin are getting used, and therefore you're going to get rid of some fat. The unfortunate side is if all you do is rely on those, you're going to lose about 30% of your weight in lean mass. And
Mm-hmm.
the goal is to hold on to your lean mass. I mean, I've said this for a decade, right? It's you know, your muscle is the currency of aging. You've got to hold on to that lean mass.
Mm-hmm.
And the older I get, the harder I got to try to keep that lean mass on. Now solidly in my 60s, I got to work hard to keep that lean mass on. And I think that's where people get thrown off. They're still looking for the magic bullet, and in this case, the magic shot. And it really, if you're serious about correcting metabolic syndrome or correcting your dysmetabolism or metaflammation, you have got to take on and adopt a new way of living. It's that
Mm-hmm.
simple.
Yes. So let's start and go back a few steps and see. So we are suspicious of someone, or we have our doubts that someone has metabolic disease and or insulin resistance. So what, first of all, tests, biomarkers you normally check? What are the commonest things that you want to check to diagnose and establish the diagnosis?
Yeah, I mean, the easy ones are obviously glucose and insulin. So as soon as someone has a blood sugar over 90, they're starting to create damage in their body. And when they're solidly in the 90s, which is still normal, say you have a 95 blood sugar, you're at a 60% risk of being a person with diabetes in the next decade. Or if you look at another study, it would be a 45% risk. 9 points for every point over 90 or 6 points for every point over 84. And so glucose and insulin are big. Now, if you're looking for, and then lipids as well. I mean, a lot of people are like, oh, lipids, they really matter. Well, it turns out the more metabolically disrupted you are, the more you make bad actor lipids.
Mm-hmm.
So cholesterol does matter, but it's the kind of cholesterol you make. Are you making small particle bad actor lipids? Are you making lipoproteins that are inflammatory, that damage your tissues and slow your metabolism down? So lipids can be important. Glucose and insulin are real important. I find red blood cell magnesium important because low magnesium status is the number one nutrient deficiency associated with the development of metabolic syndrome, which is prediabetes, prehypertension, and obesity. So, getting a red blood cell mag, really important.
Mm-hmm.
And then you can look at other markers of how inflamed are you. Things like homocysteine or C-reactive protein. They give you an idea, mean platelet volume. They give you a core idea of how much inflammation have I got going on in my body. Because in the end, the more metabolically inflamed you get, the more you're throwing out these inflammatory cytokines, the more your insulin receptor gets disrupted.
Mm-hmm. So we check CRP, some inflammatory markers, homocysteine. We want to check the magnesium, but the RBC magnesium, and
Glucose and
A1C,
insulin.
fasting insulin, and fasting sugar. So those are very important
Yeah,
markers.
they are. And obviously hormones, I think everybody should start looking at their hormones, because you see, my gosh, I'm seeing 25-year-old men with hormones of 80-year-olds nowadays, right?
Mm-hmm.
So I think if you're going for a very complete picture, you want to look at hormones. And of course, if you're considering being on, a drug like Ozempic, the GLP-1s, you got to check those baseline liver and kidney function,
Mm-hmm.
AST, ALT, creatinine, and then, of course, check lipase and amylase, right? Just because those are important if you're going to be on a medication. Somebody just asked, what should insulin level be? A fasted insulin really should be around 5, like 3 to 5 would be ideal. Mm-hmm. When you start getting up around 10 and your glucose is 95 and your blood pressure is borderline high, now you're creeping towards that metabolic disease.
Yes. Yes. So we now diagnosed, and we know what this problem is, or what the diagnosis is. So first thing, we want to come with some diet and advice about the diet. There's so many different diets. Some diets we are established, like blood pressure diet, DASH, or for heart disease, Mediterranean diet. But we see so many different diets for weight loss: high fat, low fat, keto, low carb. So it's confusing. Some very fancy, but calorie restrictive diet. So, and again, short term, we see a lot of them work. But the problem is one cannot sustain or continue and maintain these restrictive diets. So what are your thoughts, or if you have experience with a good diet that really works and people can continue and sustain it?
Well, I have a lot of thoughts on diet, because I've been passionate about diet for a long time. Obviously, my spouse, Laura Lavelle, is our lead dietitian within our organization. She also educates for us. And I think here's the thing. You can only stay on a restricted diet so long. One of these days, you're going to go by a bakery, or you're going to go by a pizza parlor, or you're going to, whatever, and you're going to have that event. And it's really understanding, well, what's the lifestyle that I need to eat? Think of food as information. Food is information for your body to either say it's good fuel, it's not triggering inflammation, or it's not good fuel, it's helping me to store fat, and it's triggering inflammation. So you start thinking about food as information. My father was a world famous chef. I love good food. Literally one of the top 100 chefs in the world, decorated for decades, one of the most decorated chefs in the world. So I dig food, right? All good. Mm-hmm. But at the same time, what we really believe in is kind of in general, is just a modified low carb, low allergen, anti-inflammatory diet to get started. So get the inflammatory foods out. For most people in the U.S., it's not going to hurt them to go off of gluten and cheese for 8 weeks and see how you feel getting off of that. I know for me, when I eat dairy, I'm going to gain 3 pounds of water. I'm going to feel skin tightness. It's not going to be a good thing for me. And it's been that way since I was a kid. So in terms of the diet, it's like, I think Mediterranean is a good place kind of to finish. But I think it's still too high in carb when you're first starting out with somebody that's insulin resistant. I think eating time restriction, I really don't want people going past 12-12 or maybe 14-10. If they want to go 16-8 once or twice a week just for a little bit of a digestive rest, okay. But I don't know about you, but most of the people that have come into me that have been on 16-8s consistently, their labs don't look that great. Mm-hmm. So by default, clinically, haven't seen that really work that well. but I do think that in general, people overeat. But if you're going to try and lose weight and keep lean mass, you're going to have to eat protein. Palm-sized protein at least twice a day, and I usually tell people drink a protein drink. I mean, try to get enough protein in, because the one side effect, of course, of the GLP-1s is you get appetite suppression. So you have to eat. And I've been through I've seen every kind of diet imaginable, and the modified low carb, low allergen, anti-inflammatory diet we developed with Metabolic Code. Honestly, it's refined over 40 years of work. It works. Now, sometimes people have to be ketogenic, but hopefully responsibly ketogenic. Say they got a battle in brain cancer or they've got epilepsy, right? There's some room for those diets. But at the same time, people need to eat more vegetables, 3 vegetables for every fruit. That's the rule I give out. Legumes if you tolerate them. And then you got to see what your carb load is. Like how much carb can you take in and not gain weight? Are you working out 2 hours a day? Are you working out an hour a day? Are you sitting on the couch watching TV 3 hours a day? It starts to vary based on genetics and based on levels of activity. And then you just have to watch, where is my, where's my set point at? And what foods, if I eat a food and I gain 3 or 4 pounds of water by the end of the day, I probably ate a food that I'm sensitive to.
Mm-hmm. So anti-inflammatory food, you mentioned not to eat or avoid gluten and dairy for at least 8 weeks. Any other suggestions? So what are the anti-inflammatory foods that people can have more? Is that vegetables, for example?
Yeah, I mean, look, I think in general, when people eat, they eat more vegetables and probably more cooked vegetables initially if they're having any GI problems. That's a pretty safe bet. Now, you will have people, like you said, they'll try the carnivore diet. They're like, oh my God, it's amazing. Or they'll try the keto diet for like the first 30 days. It's amazing. Well, of course it is, because you were so insulin resistant that when you ate carbs, you felt terrible. So yeah, but there's usually there's a cliff, right? 30 or 60 days, sometimes 90 days. People go, oh, wait a second. This skewed diet isn't working for me. And so I'm a big believer, if you look at the long-lived cultures, right? Long-lived cultures, they actually live with a pretty varied diet. So we shouldn't have to be so restrictive. Legumes are good, but some people are sensitive to those. Proteins, typically animal proteins aren't people won't get too reactive to unless you start testing for them because they've got gut problems. So those aren't a problem. Although you do have to watch if you're an ApoE 3.4 or 4.4, you don't want to be eating a lot of saturated fat, whether that's coming from animal protein or coconut oil, right? Big mistake people make as they start hammering the coconut oil because it's in vegan cheeses and you can put it in your coffee. But if you're an ApoE 3.4 or 4.4, that's going to trigger inflammation, and that's not going to be a good thing. So that's mainly it. I've made it pretty easy for people, at least through my career, of look, here's a big list of vegetables. We don't need to malign potatoes, but don't eat them as your main vegetable. Eat from a wide variety of colors and foods. And then I try to get them to eat a higher protein breakfast because your cortisol is highest in the morning. And that means you're going to be the most insulin resistant in the morning. A little higher protein in the morning. If you're going to, with the carbs you're going to have, try to reload those into the evening to stimulate serotonin production. And that's it. I mean, and then if we have to test for foods, we test for foods.
Yeah, so we're talking about now gut health problems, and what are your thoughts about? Of course, there's so many gut health issues nowadays, and should we feed the microbiome or with fiber, or should we go and take probiotics, natural versus supplements? So much, again, people are confused. This is something that all the time they ask me. So prebiotic, postbiotic, or probiotic to lose weight?
First of all, I've never really given people probiotics, and that's the only thing I did, and I saw them lose a bunch of weight. If I combined an elimination diet with them, or we tested them for food sensitivities and got the foods they were sensitive to out, because when you have food sensitivities, by default, your microbiome's disrupted and your gut's permeable. It's got to be, right? So I love fermented foods. Not everybody likes kimchi. Not everyone loves sauerkraut juice. I love drinking sauerkraut juice, not just eating sauerkraut. I really like that taste, which is kind of rare. But so I think you need fiber. You need a prebiotic. You need to feed the fuel for your microbiome. The more your gut is compromised, the more gas, the more bloating. And I'm not talking about do you have SIBO. I'm talking about in general. You've had a history of antibiotics, you're under stress, you're kind of belchy and burpy. The more you're going to need to take some probiotics. Of course, I'm big on, well, are they DNA verified strain probiotics? Are all the probiotics that are in that bottle, are they all guaranteed to be living at the time of expiration? Because you put a bunch of probiotics in a bottle, it's the Crips and the Bloods, man. They fight each other. And so you need compatible probiotics that are DNA verified, that are guaranteed to the time of expiration. And then I'm like, yeah, do a probiotic. People drink kefir. Problem with that, it's dairy. Somebody asked about whey protein isolate. Is that included in dairy? Some people will tolerate whey protein isolate even though they have a dairy issue. We typically take it away from them and then have them put it back in and see how they feel, just to kind of be pure about the no cows dairy, right? So to get that whey protein out. So, I give people fiber. I'm a big believer in fiber. If you're taking hormones, you should be taking fiber. Fiber helps protect your microbiome so that you don't make unfriendly flora, because unfriendly flora make an enzyme that cleaves off your hormone metabolism. So, your hormones are floating around with a little handle on them, and that handle gets cut off because you make something called beta glucuronidase when you're eating a high fat diet or high refined carb diet. Either one of those, and that means that hormone comes undone, and now it's floating around and it's going to store as a free hormone. And that's how we get into things like estrogen dominance and poor hormone regulation.
Yes. So with diet, just to recap, we're trying to have anti-inflammatory diet, modified Mediterranean, lower carb Mediterranean diet. That's very healthy and very good for heart and for losing weight. And now talking about supplements like magnesium. So you mentioned we check the levels of magnesium, for example. So, and we know many of people are nowadays low on magnesium. So what are the supplements you normally want to introduce in people's?
I mean, a couple as it relates to weight loss. So magnesium bisglycinate is the one that is probably best absorbed, overall best value if you're going to buy it for like what you get out of it. You'll get that tissue level up. If you're having any kind of heart palpitations, magnesium taurate is acceptable. If it's muscle aches because you're working out a lot, magnesium malate, but the malate sometimes upsets your stomach. If you're like a woman with IBS, malate wouldn't be good. So I tend to push people towards mag bisglycinate. A lot of people take mag threonate at bedtime, which is good because the threonate helps calm your brain, but you don't get a lot of magnesium out of that. So you want to get your mag pool up, at least on red blood cell mag, to a value of 5.6. The other trace mineral really important is chromium, because even when we eat healthy grains, nobody's going and buying, raw grain like wheat berries and grinding them and immediately making their food. Because we micronize a lot of the processing of food, chromium is one of those nutrients that we just don't get in our diet that much. And chromium is essential to make your insulin receptor work. It's called chromium transport binding protein 4. Wow. And it's this molecule inside your, it's this little enzyme that is inside your cell. And if you don't have enough chromium, it doesn't act like it should, because it actually helps with the way your insulin actually binds to the insulin receptor. Because when that's not working, that's when you go into what's called the Warburg effect. You start bringing glucose in passively. Now you're only making 2 packets of energy instead of 30 plus packets of energy. And now you're gaining weight because you got a lot of inflammation going on. So mag, chromium, zinc, very important for the insulin receptor. You could argue niacin too. Vitamin B3, really important.
Mm-hmm. So we start those, and so we have the supplements on board. And what other lifestyle modifications advice for weight loss management? So you mentioned about sleep, for example, and also exercise.
Yeah, I mean, I'd tell you one of the big modifications is you've got to get people to calm down. Like if you haven't had your 4-point cortisol check to find out if you have your diurnal pattern of cortisol intact, meaning cortisol's high in the morning, drops at noon, drops again at 5, goes to nothing at bedtime. If you're flat and going like this,
I was.
that's you flatten your cortisol curve. You are definitely going to see cardiometabolic disruption in your body. You're going to gain weight. And so the big thing there is I teach people how to, box breathe a couple times a day. Like at noon at your lunch break, take 3 minutes and do box breathing, right? 4 seconds in, hold 4 seconds, 4 seconds out. Think of the stress of the day as you're exhaling that you're letting go of, and then 4 seconds hold. And you do that for about 3 minutes. And when you're done, think of something you're grateful for. And do that again at the end of your workday, or do it before bed. And then also you have to realize if you're having trouble sleeping, sleep really tears your metabolism up. If you're not sleeping well, that's why people with apnea gain a lot of weight and get insulin resistant, right? When you're not getting enough sleep and you throw off what's called the master slave clock of your brain, which regulates all of your metabolic reactions, your insulin regulation goes out. So people can't cheat sleep. And if you're having trouble getting asleep or staying asleep, it's because of it's called a disorder of hyperarousal. Your brain took on too much juice during the day. You can't unload it at night, right? It's still like this. Oh no, there's a white tiger chasing me. I'm sure there is, right? And you want to, so you got to change that. So theanine, I love the natural compound theanine. And I usually start people with 400 milligrams 3 times a day because I want to make sure they feel calm. It won't make you drowsy. Or if they're craving food, like, you get home at 4 o'clock and you hug the Lay's potato chip bag as soon as you get home, or you grab a tortilla chip bag and before you know it, it's empty. That's a compound called Relora, Relora. Typically give that 3 times a day at 250 milligrams. And people will notice, and I've done research with that compound for 20 plus years, I'm not craving as much. And my point to the GLP-1s are, even if it's suppressing your appetite, if you're still stressed out and not sleeping well, you need to work on that, because one day when you go to get off that medication, you want to be able to have that stress like calm waters, and it's like a cool breeze, not, hey, I'm back to my old lifestyle and stress eating, and all of a sudden the weight's coming back twice as fast, like people see on yo-yo diets or the old HCG diet, where as soon as they go off, they overeat because they're undercaloried. And when you're undercaloried, eventually you release ghrelin, and that ghrelin makes your appetite go crazy, right? So you want to avoid peaks and troughs. You want to gain a lifestyle of managing your eating, your stress, your behavior, your sleep. And then remember, food can be fun. I love healthy food, and we're creative in our home.
That's good.
But remember, food is information, and you have to pick good information, not bad information.
That's true. Yes. So we work on our lifestyle and then get to the juicy part of our talk, which is medication now. Everyone love to have GLP-1 agonists, analogs, injectables, orals now.
Rub
So
them on, whatever.
GLP.
Dump me in a bath of them, whatever it takes.
So yes, again, I mean, I have prescribed it to my patients. It's really still not enough evidence how far if we have to stay on these for forever, or at some point we can stop and not gain back all those fat, visceral fat.
Right?
Again, I hear something about because of loss of muscle when taking these medications. I hear there now some formulation about making the ones that is not breaking down muscles and preserve muscles. So I'm not aware of that yet, but I think it's someone is working on it now.
Yeah, I think it's on the way of having
Mhm.
compounds that'll help maintain lean mass. I think here's my experience been in working in our clinics with my docs. You know, if you eat enough protein, if you adopt exercise, if you manage your stress, make responsible decisions on your food, you're not going to lose a lot of lean mass. You're going to lose fat mass. If all you do is rely on the medication and that's it, I don't want to change anything. That's where you get into that risk of, the quote Ozempic face or Ozempic butt, losing. Like, we don't want people losing weight too fast. The way we use it is we start with a small dose and slowly build the dose to where someone's losing weight, and then we stay there. Because it'll be easier on the person to come back off if they're getting by using less of the drug, and you don't run the risk of things like gallstones when you're dropping, rapid amounts of weight. So I really believe that you can get people to titrate up to a minimum effective dose. You can change the chemistry, like you said, hormones, whatever it is, stress hormones. Then see how they perform. Like, how well are they doing on staying off of that GLP-1? Obviously, the new oral botanical out of New Zealand is interesting. Amosarate, it's a hops extract that acts like you take it, and for 4 to 6 hours, you get a ramp up in your GLP-1 activity. So that's really promising. They've got some interesting studies on it. And I think it's a good thing that you can come off of. I'm not in that camp where you're hearing that people are like, oh, you're going to have to be on it the rest of your life. Only if you're not willing to change. If you're not willing to change, you're probably going to be on it the rest of your life.
Yeah.
So, that's that old story, doctor, it hurts when I go like that. Oh, okay, don't go like that, right? You've got to decide what's more important to you, is like being able to eat an extra piece of chocolate cake or maintaining your weight and losing all of the comorbidities. As you know, when someone's pre-diabetic or diabetic and then they're obese, dementia risk, heart disease risk, kidney disease risk, non-traumatic blindness, there's a lot of problems when you start piling up all those issues.
Depression,
Yep.
mental health, yeah.
All of that, right? Joint aches, right, from being overweight. So there's a lot that's going on now. I think that even when people are, say, 20 pounds overweight, but their labs look really bad and they've tried their best, nothing has worked for them. They exercise, they diet. And look, even with exercise, try to get a little bit of resistance training in, a little bit if you can, but just start walking. Start getting in a good 45-minute walk 5 days a week. I mean, that's, if you can get 30 minutes in 5 days a week, it's a huge plus. But the point being is that there may be people that aren't necessarily 60 pounds overweight, but they still need to get that insulin receptor working again to drop that 20 pounds, especially when more of it is visceral fat, which is the dangerous fat, right? That's the fat that's pushing out all these different, what are called adipokines, right? Inflammatory compounds out into your chemistry.
Mm-hmm. So have you heard, like, when patient reaches to, they say, doctor, now my weight is plateau. So what do we do then on GLP-1, on medication? So what do you normally do? Would you go a little bit up or fiddle with the dosage of the medicine? Because we see that again quite often happen.
If they were on semaglutide and they plateaued, we'll suggest that they get, like what we taught at the weight loss certification course, we'll have them switch over to tirzepatide. If their semaglutide dose or their tirzepatide dose isn't that big, we'll suggest that they go up. Mm-hmm. Now, I mean, at the same time, we're going to review, how are you eating? Are you moving? What is your stress like? What do your labs say are going on? Is your glucose and insulin good, but your cortisol's through the roof? Hey, we still got to work on that stress, right? Mm-hmm. So I think it's important when someone plateaus that you explore the why, right? Mm-hmm. I mean, some people plateau a bit because when they're losing that fat, they're releasing toxins, right? Because toxins store in your fat. We've all kind of read that now. And your body has to process that stuff, right? And sometimes you get a little bit of a plateau when you're dumping that. But in general, just a little increase or flip over to a different GLP-1. You could obviously use a different kind of compound, like tesofensine is a interesting compound. But I still really encourage people, look at your diet. Are you eating too much, even of the good stuff? Where's your movement at? Where's your stress at? Where's your thyroid at? Where are your hormones at? If we've reached the, what may have happened is you got to the weight that was dependent on the insulin resistance, but you may have weight that's, say, dependent on estrogen dominance, right? So you may have to continue with managing that insulin and glucose, but you have to move to a different aspect of their metabolism to really correct it.
Yes, and as you mentioned, to make sure that all the detox pathways are open, working, and in order. So that's very important.
100%. Even simple things like, acetylglutathione, you can use a liposomal tablet. If people are foggy-headed, obviously synapsin is great. The lipotab is synapsin. But the big one, honestly, if they're plateaued and they haven't worked on their gut at all, they haven't done illumination of foods, I'm telling you, that's a big part of it, is to really work on getting rid of those inflammatory foods. And usually what will happen is they'll go, wow, I dropped another 3 pounds this week.
Yes. So I think the whole talk tells us this is multifactorial and we have to deal with it so many different ways. So it's not just having the medication and that's the end, we're good to go. So there's so many other aspects that we have to work on.
Absolutely. And look, the GLP-1s are amazing. I really believe they're a great tool. I think there's other peptides that could be great tools as well. But the GLP-1s are amazing. It's just putting them in their proper perspective in place so that people really get to enjoy the benefit of fat loss, lean mass retention, better cognitive function, heart protective, right? Kidney protective. There's a lot of benefits, but it's that multifactorial event.
Yes, true. So anything else you suggest or advise to patients to do, or to people who are watching?
I'll tell you one, it's like, have fun, have joy in your life, right? Try to do that. It's easy. I think it's easy for us to get caught up. I know I'm very busy, and but I try to remember to have fun. And also, probably the biggest one, as it relates to weight loss, try not to be hard on yourself. Give yourself some grace and try to work through your issues and find help. And don't feel defeated, because there is a solution. And that solution, you're going to have practitioners and providers that care about you, that can help you along the way. Grab onto that and really be relentless to get to the health you deserve.
Yes, I see again a lot of people who become frustrated, depressed, and not able to lose weight. So, and that again affects their cortisol, and that stress. It's more insulin resistance. Someone was asking if you could repeat the name of the supplements that you mentioned. Relora was one of them for.
Yeah, Relora, Relora. I mean, we've got a product I designed called Quicalm, Quicalm. That's Relora plus theanine. It works really well. But if you just wanted to get Relora, Relora, 250 milligrams 3 times a day. Theanine, I prefer suntheanine because it's the patented ingredient. I like giving 400 milligrams 3 times a day if people are stressed out. Like, I'm feeling anxious, feeling nervous, feeling overcommitted. That's what you want to do. If you're just kind of, hey, I'm a little overcommitted, I'm not sleeping good, 200 milligrams 3 times a day. And as you get calmed down and you're taking control of your health and your stress, you start to take those things away. You don't need them as much.
Mm-hmm. One last question is for people who are in Canada, like myself. How can they have your supplements? Is there any way that you ship them here, or they can buy it like on Amazon or your website?
Canada, it's very hard to ship supplements into. We are actually working on getting into Health Canada, so it'll be coming to Canada here in a bit. But yeah, I mean, I've worked in Canada for a long time. I was in Acton, Ontario for about 10 years, right outside of Mississauga. I went there for 10 years, and I also worked in Richmond Hill. That's where I first got trained by one of my first mentors. So I'm very familiar with Canada and lectured all over the country. So Acton, Ontario. You know I know Canada if I mention Acton, Ontario, right?
Listen, it was amazing to have you here today. Great, and we can't have enough of you. You just have so much knowledge and experience. Love it.
Well, thank you so much. I enjoyed this. So anytime.
Thank you.
Love to come back anytime.
Sure.
That was a bunch of fun.
Thank you very much, Dr. Jim. Take care. Good day. Bye-bye.